your prescription here, it says you're needing a ACL brace, correct? Okay. And then what sports do you play? Do you play any sports? When will you be wearing the brace most often?
I play soccer, so probably games and practices.
Okay. Okay, we'll just make note of that. And then is it your right or left leg?
My left.
Okay. Awesome. Okay, we'll go ahead and get some measurements. Okay, so if you'll go ahead and stand up, we'll get some measurements. We'll just have you put your legs about shoulder width apart. This is the measuring device that we're going to use. And we'll just set it on here. We'll put the pads where the condyle pads will be on your knee brace. And because you play soccer, you'll be in a lot of contact sports or running. We're going to go with a shorter calf measurement, and then with the standard one up here. It's going to come about here and then swoop down. So if that's okay height, we'll go ahead with that. So I'll just measure it real fast for you. Okay, so it looks like it's sitting on there about right. From there, we just kind of put our fingers under to grab some slack so it's not super tight. We'll just read the measurements. Okay, so this is what the brace looks like. What we're gonna do, I'll first put it on, make sure it's fitting correctly, and then I'll kind of show you how to go through it and do it yourself. Okay, so what we'll have you do, we're gonna have you just kind of step through it, and then you can put your foot here on my chair. There you go. And then go ahead and just scoot a little forward. Perfect. Just slide it on. Okay, so that looks good size for you. So then what's next is all of these straps are numbered. This is number 3, this is number 2, and so forth. So this little strap is what I do first. I like to call it strap 0, just to make sure it is on there first. Before that, you'll want to make sure these condyle pads stay where they're supposed to. So if you were to take a line and then draw it across, what you want is the line to hit the top of your patella. Okay, so we'll just sit it on there, and then as you do up the numbers correctly, it kind of pulls the brace down. Sometimes I'll adjust these pads just so they're in the right spot. You shouldn't have to do that again, but just at first. So we'll start with number 0, then we'll go to number 1, and then we'll come up here, this one. And if these straps are too long, which it looks like it's okay, but if they're too long, we can trim them if it needs to be. That it just kind of snugs down on you, just perfect. Do number 4. And then number 5, I never undo, just because you don't really need to, but every time you put it on, I do like to kind of pull it tight. The most important straps, I think, are 4 and 5 and number 3, just because it sets the brace on you. Make sure it's stabilizing where it should be. But that is it. If you want to stand up, kind of try it out, walk around, see how it's feeling for you. Does that feel okay?
Yeah, feels great.
Okay, wasn't pinching anywhere or too big?
No.
Okay, perfect. So now you know how we kind of go about fitting and measuring the brace for the patient. If you have any questions, feel free to contact us at 801-226-4741. We can set up an appointment and make sure that there's a trained personnel here that can get that fitted for you. Have a good day.